Officials in Texas are reporting the country's first death of a patient infected with monkeypox. The state health department says the person was severely immunocompromised. It's not clear yet whether or not monkeypox actually played a role in their death.
I think it's important to emphasize that deaths due to monkeypox, while possible, remain very rare. In most cases, people are experiencing infection that resolves over time, and there have been very few deaths even reported globally.
For more on this, I'm bringing in Dennis Nash. He is the executive director of the City University of New York Institute for Implementation Science and Population Health. And he's also a distinguished professor of epidemiology at City University of New York's Graduate School of Public Health and Health Policy. Quite a title there. But it sounds like you're the right person to talk to. So give us just a fact check. When people hear about the first person who had monkeypox dying in the U.S., they may become scared about it. Dying from monkeypox is really rare. What are the more common negative impacts of contracting it?
It is rare. This is the first potential death among the 18,000 or so cases that have been counted in the U.S. so far to date. But as we heard, it is more common among people who are immunocompromised. A concern here is that the virus has been spreading in the community of men who have sex with men around the U.S. and around the world. In that community, there's a higher prevalence of HIV and the potential for people to be more likely to be immunocompromised if their HIV is not well treated. So this is a concern, but I hope it continues to remain rare.
But there still are other negative implications about it. Does all of this elevate the concern for health officials or change the way potentially the illness will be addressed?
I don't think it changes anything. This is a standard approach to this outbreak is to, prompt isolation of cases, testing and access to vaccination and treatments for people who are most at risk. And this has been what is effectively driving a decrease in the cases from its peak back in July. I think we've definitely seen the rapid declines in New York City, and we're beginning to see those same declines in the U.S. and globally. So I think the officials are responding properly. It would be great if it had been faster with better rollout of vaccinations and testing and things like that, but I think we're beginning to get on track now.
Those declines are really promising, but are you concerned about an increase in transmission as students head back into the classroom or college students return to campus?
Well, I think that it's possible and likely, actually, that we'll see some cases in schools. We've already seen cases in kids, including young kids, and this happens when they have close contact with other cases, for example, in their households, and older kids older adolescent kids are having more close contact with each other, and this can result in some cases. I don't expect to see the kind of explosive outbreaks that we've seen so far that have been limited to the men who have sex with men community for the most part.
Really quickly, is there anything that parents should be aware of?
I think that it should be expected that you might hear about cases in your school or in your community. These will have to result in prompt isolation and contact tracing and quarantining. And as long as these things happen quickly, this will effectively prevent spread in communities and schools.
All right. Dennis Nash, thank you.
Thanks for having me.